Hello and welcome to our virtual roundtable discussion, Bridging the Gap, Advancing Psoriasis Care in Europe. Thank you for joining us. I'm Renee Wyndham, former BBC journalist and now your moderator for this session. Joining me are Ilse van Ee, Dr. Tiago Torres, Penela Gunter, and Antonio Manfredi. They'll introduce themselves in a moment. The latest Economist Impact report is called Beyond Skin Deep, Tackling Gaps in Psoriasis Care. It was commissioned and supported by Bristol Myers Squibb, who are sponsoring our discussion today. We're pleased to be able to bring together for our roundtable a panel of experts, healthcare providers, patients, and advocates to focus on the report's recommendations. And these recommendations include addressing the stigma, misdiagnosis, and undertreatment of psoriasis by improving awareness, improving equality of access for all patients to have effective care and, as well as screening, facilitating the early diagnosis of comorbidities, updating the guidelines of national policy and treatment to make access to treatment easier and to make the approach to treatment consistent across nations and regions, improving the quality and use of how data is collected, looking particularly at disease burden and registries, and making sure that multidisciplinary teams and shared decision-making are encouraged. Our particular focus today is to bring these recommendations and a call to action down to the local, regional, and national levels. Before we look at our panel and who are going to introduce themselves, I'd like to welcome Jasmine Greenemeyer. Jasmine is Vice President of Global Patient Outreach for Bristol Myers Squibb. Welcome to our round table, Jasmine, and we look forward to hearing your introduction.
Well, thank you so much, Renee, for opening this for us. And a warm hello to all of our participants across the globe. We really appreciate that you've helped join and make time for this timely discussion. And it's my pleasure, as you said, to set the stage for today's conversation. Let's first highlight the global impact of psoriasis. We know that it's estimated that over 100 million people worldwide live with this condition, and over 6.4 million are in Europe alone. So World Psoriasis Day provides us that opportunity to give special recognition to this chronic systemic disease. And I'm very proud to work at BMS and all that we've been doing to support the psoriasis community 10 years and counting. Our partnerships extend beyond our labs and include efforts to increase access to treatment and collaborations to help increase the understanding of psoriasis. Ultimately, we want to support and improve the daily lives of people living with psoriasis. I'd like to review a few of the challenges that we know are associated with this condition. For example, about half of patients with plaque psoriasis experience substantial fatigue. We know that individuals with psoriasis are 4 times more likely to take antidepressant medication. And approximately a third of psoriasis patients develop psoriatic arthritis, which causes joint pain, stiffness, and can lead to long-term joint damages. So given all these challenges, we are encouraged to see progress being made to improve care, such as the multidisciplinary treatment models we may hear about today, treatment registries, and campaigns to help increase the understanding and visibility of psoriasis. And we know that much of this progress is a result of the tireless, important efforts of patient organizations. That includes IFPIA, EuroPSO, the National Psoriasis Foundation, and many others. Please know that we're proud to work alongside you as we work to fulfill our shared mission. I also want to take a moment to express my deep gratitude to each of the speakers today. What a wealth of expertise and diverse insights you will bring to this discussion today. So let me turn it back over, but before I say that, I'm very confident we can continue to make great strides in psoriasis care by putting patients first and working together across sectors and disciplines. So thank you. And I believe, Renee, you're muted.
Thank you so much, Jasmine, for that very rousing start, and it'll really get us going. And interesting that you mentioned fatigue, which is not one of the things that we've actually brought up, but I'm sure the other patients will talk about it. And many of the points you raise and that we'll be discussing further about education, outreach, awareness, collaboration to advance research, supporting people affected, and so on, will feature now in our panel discussion. And now it is time to introduce our panel. It was so nice to see you, Jasmine, and I'm sure that you will listen to some of the outcomes that we hope to find during our discussion. So we're going to start with you, Ilse van A. You're a psoriasis patient from the Netherlands, and you advocate for psoriasis patiënten. So tell us a bit more about psoriasis patients in the Netherlands. You're muted, Ilse.
Yeah, it just starts coughing, sorry.
No problem.
Sorry, I had a little bit of cold. Yes, I'm a patient representative from the Netherlands. And I've had psoriasis since I was 4 years old. And it's very important that today, on World Psoriasis Day, we talk about the impact that psoriasis has on everybody. And we move on. Sorry, it's my cold.
Don't worry, you're very good to struggle through. Thank you very much. Pernilla, you are from Sweden and a former politician, and you founded Focus Patienten in Sweden. What work does Focus Patienten do?
Well, Focus Patient is a meeting place, I would say, a platform for healthcare and for life science with a patient perspective, because we do believe that everybody involved in healthcare and also the life science, I mean, with medtech or pharma, they really need to have a patient perspective when they are working. And what we are aiming for is also that people should be sitting at the same table and also be discussing with each other like we do today or other events, because we do believe in the fact that we need to have different angles for the same topic and to understand each other when we are talking about the struggle with policies or with struggles with organizations and so on. So that's what we are doing.
Very good. I'm sure that theme will come up over and over again about people listening to the struggles of it, listening properly and doing something active about it. Dr. Tiago Torres, you're from Portugal, Professor of Dermatology at Porto University. So tell us briefly a little more about yourself.
Okay, good morning. It's a real pleasure to be part of this webinar today, the World Psoriasis Day. So I'm Tiago Torres, I'm a dermatologist. I'm Professor of Dermatology at the University of Porto in Portugal. I've been involved in the field of psoriasis for a long time. I'm currently leading the psoriasis clinic at my department. I'm involved in several scientific organizations related to psoriasis, the IPC, SPIN, GRAPPA. And additionally, I have the fortunate opportunity in the past years to work closely with the Portuguese Psoriasis Patients Association in several projects. So it's a real pleasure to be here.
And it's a great pleasure for us to have you as well. Thank you, Tiago. And to you now to Spain from Portugal, Antonio Manfredi. You, like Ilse, are a psoriasis patient, and also you're an advocate for Acción Psoriasis in Spain. Tell me what it does.
Okay, I think today is raining a lot here in South Spain. I am in Seville. Maybe I think I am in Netherlands too. Okay, Catherine. Okay, in Spain we have a problem. We have a 17 health system. It's very complicated to have. We don't have one unique portfolio of service. Depending you live, this is your quality of life. Now we are working a lot in Acción Psoriasis to especially send the benefit to all people from innovation, because now it's not happening, and we are very interesting to have that, especially talking with the government, with the Minister of Health.
I think they're very lucky to have you pushing on their behalf, Antonio, and also Ilse. So we'll hear quite a bit more now in our discussion. And of course, you can all join in at any moment you want to add a point that someone else is mentioning.
Okay.
So we'll start now by thinking of the importance of, which is brought up already in what you've been saying, the importance of sharing the decision-making at a local level so that there's collaboration between the patient, the doctor, the healthcare provider on the goals of the treatment. Ilse, if you can get through your cold, you're very good. Thank you. We appreciate your struggles. You're an advocate for psoriasis patienten, as you said, in the Netherlands. So what changes would you like to see to make sure that people feel informed and empowered to make the best decisions themselves about their own health?
Well, to really make choices, you need to know a bit more about your skin, about your disease, about your immune system, to really understand. And that the information should be brought to the patient in a way that the patient can understand it. Because we all learn on a different way. I see my teenagers watching movies, and I see myself reading a leaflet. And in that conversation with the healthcare professional, you also need to talk about what's important for you, because it's all different for everybody. And I really think if there's a good conversation, then you can do shared decision making. But it starts with good information.
And what if patients have less literacy about them, if they're finding it much harder to express themselves?
Well, I don't think they find it harder to express themselves, but there's always the time limit, and you have to you have to engage as well as a patient. But it is, if you heard that you got a chronic disease, it's a bit okay, and then we still tell people, well, get used to it. But there are so many options, and you need that information to really be able to make those choices, and you have to give it a place in your life. So it's not nothing, and you have to take time for it as well.
Yes, I think that's a very good point about the time, Pernilla, in policy making. I mean, how does it come about that one has a certain very limited time with one's healthcare professional?
Well, I think it's of course to the healthcare system to decide. Of course, a political decision cannot say that the doctor needs 20 minutes each patient or something like that. But we can, as policymakers, of course, there is a possibility to at least, make the possibilities so great for people to work in healthcare that they feel they have the time to really inform the patient. And also I think for the government or in each country to also support the patient organizations to be able to inform to their fellow colleagues in the patient community. So I do believe it's more of a policy work at some levels, but also for the healthcare system to decide, okay, how many people do we need to take care of these patients? And then we can also see the number of minutes or the limited time. How should it be really in reality? How should it be executed?
Thank you for that. But Tiago, you must come with this. It must be even frustrating occasionally to know that you're limited by time with a psoriasis patient.
Yeah.
How do you deal with it?
Yeah, that's an important limitation. But this topic of disease-making processes is really essential. There's a lot to improve. And it's very important to incorporate patients in this decision-making process because there is data, studies, in several fields of medicine, including psoriasis, showing that when the patient is incorporating in the disease-making process, it may improve the clinical outcomes. So this is very important. But when I see my reality and reality in many other countries, this remains far, it's not a reality in many of these places. One of the problems is there is still a huge disconnect between patients and healthcare providers regarding treatment goals. So this clearly leads to poor outcomes under treatment. And as it has been said before, we have to act in several levels on the patient, on the physicians, but also on the healthcare system. For the patients, clearly is through education. This is very important. The patient knowing about the disease, it's very important to, it will be easier, the conversation and the power of the patient in the therapeutic decision. And then for physicians, there's the limitation of time. And this comes with improving the healthcare system. And just to finish, I know you are running, I'm probably running out of time, but just to tell that in specialized centers, there's more time. So try to expand specialized centers is very important.
That's a very concrete decision there. One of the ones when we talk about action, to expand specialized centers, that would make a great step towards psoriasis care, because there aren't enough, obviously. And also, what do you think that so far in the Netherlands is any kind of model that is already in existence for the shift of collaboration between the patient and the healthcare provider?
You mean in the consultation room? Or?
Yes.
Okay, yeah.
What have you learned so far in the Netherlands?
Well, what we learned is that a patient finds it's important that there's communication through all healthcare professionals. So like a rheumatologist and a dermatologist, that's important for patient. But we also learned that the dermatologist nurse can also really help giving care, because they most of the time they do have more time, and they're more approachable, I think. So that's a very good solution, because it's very it's a good way to just give information and also talk about what questions do you have for the dermatologist, and that can really be a solution. Yeah.
Very good. Well, you've all put forward so far in this section some very practical ideas. You just now, Ilse, mentioning the importance of nurses, because we talk all the time about doctors, but in fact, nurses, you're nodding, Antonio. What is your experience with nurses?
Yeah, I agree with you. I was thinking in the nurse, it's very important for us. And for us, it's too important. We are working in Action Psoriasis to make the role of the patient association to prepare with the patient. The moment is with the contact with the dermatologist or the rheumatologist, because here in Spain we are no more than 10 minutes by connection, no more, and it's important to improve all the connection with the doctor. And for that, is the nurse is very important, especially if you need to another contact. Okay, call by phone quickly, and for us it's very important. Another question more to finish here is the problem with the patient that had a problem, but the next contact is maybe 3-4 months. What happened? I need to be with the doctor today or tomorrow. This is a question very important for us. We are working because there is a lot of problem in a lot of hospitals of Spain. Okay?
Thank you. Well, you've brought up 4 concrete ideas between you. Thank you. The importance of specialist centres, the importance of doctors giving the right amount of time, and nurses to listening to people, not just having to rush. The importance of being able to get an early appointment, not having to wait for appointments, and the importance of nurses as well as doctors in it. So we've already got some concrete ideas in the first topic. Now we're turning to the next topic about early diagnosis and comorbidities. So Tiago, from a Portuguese perspective, and also internationally, of course, what are the key barriers, do you think, to prevent the right treatment, and how can we overcome all these barriers that we've just been discussing, in fact?
Yeah, to be sure that we give an appropriate treatment for psoriasis, it is essential to first understand its systemic nature, something that sometimes physicians and patients do not know. Because psoriasis is not just a skin disease, it's a chronic systemic disease associated with several comorbidities, cardiovascular, diabetes, mental comorbidities. So, and these all are very important for the burden of disease. So, to have an early diagnosis and an early intervention, it's very important to disease this long-term impact of the disease across several dimensions: physical, social, financial, on the family, so the so-called cumulative life course impairment. And also, this early intervention may improve therapeutic outcomes. So I will go to the barriers, but this is very important, this introduction. So one of the barriers is the low awareness that exists among patients and among dermatologists. Several studies show that dermatologists and other physicians are not aware of the systemic nature of the disease. So medical education. Then there's patient awareness, patient education is so important. If the patient thinks that it's only a skin disease, he will not discuss his problem with the doctor. Then another very important thing is the fear of side effects and systemic treatments in the patient and also on the physician. So the physician is not prescribing the drug because he has fear of prescribing, and the same thing on the patient. So under treatment, medical education again. And then there are things on the healthcare system, difficult to change, again, specialized centers. If we want to have a multidisciplinary care, we need to have the possibility of doing, and we know that sometimes it's very difficult. And finally, the final barrier, the treatment costs. Again, very difficult to overcome. Advocacy, patient associations, other kind of solutions to try to overcome these barriers.
Very practical advice indeed. And you were talking both about the early discussion, early intervention, but also the long-term looking at it, and and being aware of the comorbidities like cardiovascular and so on. And so far as maybe we are actually raising awareness just with our discussion now, but the low awareness between patients and sometimes medical staff as well. And as you say, I mean, until I started looking into this, I also assumed that it was a skin disease. And that's often how perhaps it's treated. And that's why different treatments are not, the right treatments are not available or given when they should be. And it was interesting to hear from you, Tiago, that doctors are also wary of side effects. You know, one always thinks as a patient that you're worried about what the side effects are, but to know that the medical staff are also aware is quite eye-opening. Thank you. And Antonio, what do you feel having heard Tiago talk about the kind of treatment and what is lacking?
Yeah, it's a very special question for me. Me as a patient, when I am sit with the doctor, I need trust, I need confidence, I need to talk with him with confidence. I need maybe more time. Or maybe next week I don't need only 5 minutes, but when I need a moment with the doctor, please help me because I have problems. I have comorbidities. I am arthritic psoriasis patient. It's the most important comorbidity, of course, but I have problem with ophthalmic problem too, and I need to visit the doctor. Maybe I need an appointment quickly. Okay, now I am happy because I have the form to contact with my doctor quickly, and okay, it's for me. But in Psoriasis Association, in active psoriasis, we need that this mail of contact will be necessary for all the patients. But we know that it's not only a problem of the doctor; it's a problem for the patient too. Confidence, education, that's important it's a very important job for us.
Thank you, Antonio. Ilse, did you find also that the comorbidities side aspect of psoriasis was not necessarily taken into account? Was it your skin firstly that was looked at?
Well, it was, but I was very young and quite some time ago. But we only in the Netherlands we talk about the comorbidities when we have them. And if having a good treatment for the psoriasis, and if the psoriasis is under control, it prevents you from having those comorbidities. Well, we can talk about how many that saves some money. So that's a good way to look at it. And it's important that as a patient, I know what I have to look for. What I don't have the right arthritis psoriatica, but what should I be aware of? Because early prevention is better. So it is important to talk about the comorbidities when you start having psoriasis, and maybe not on the first meeting, maybe not on the second meeting, but you will have plenty of meetings with us. So just schedule it and do it like every year, talk about it, because preventing is so much better than curing, and it saves so much money.
Fantastically sensible what you say, that actually by proper prevention, you could prevent comorbidities. I sort of assumed that comorbidities gradually come as the disease progresses. But in fact, there is a way. Tiago, is that right? Could you prevent the comorbidities if you strike early enough, as Ilse says?
Well, we don't have yet a lot of evidence for the most of the comorbidities, like cardiometabolic comorbidities. Probably an early intervention may decrease the risk of developing cardiometabolic comorbidities. But for example, for psoriatic arthritis, we already have some nice evidence showing that early intervention, particularly with target therapies, may decrease the incidence of psoriatic arthritis. So it's not strong evidence, but there's some kind of a signal showing that. So clearly, an early intervention is important. It's important to decrease the impact of the disease in the long term, psychological impact, probably decrease the incidence of psoriatic arthritis. For the other cardiometabolic comorbidities and others, we still don't know, but early intervention is always better than late intervention. So
thank you. I could see Pernilla nodding there. I mean, in policy terms, how can you bring about the fact that it's easier for patients to get this kind of early intervention?
Well, I think prevention, action in preventive measures are important for us all, of course. But I do think it's more clear in cardiovascular diseases and cancer than you have for other diagnosis. Even though it's the same, most of these lifestyle changes are the same, or prevention in how you eat, how to eat well or exercise. It's the same for all chronic diseases as well. So I do believe it's more of an adjusted information to each diagnosis, in this case psoriasis, that is needed to really see that, okay, you can at least in some way prevent coming comorbidities. But we also see, in aging population, we will face a lot of comorbidities in all chronic diseases. The next 20, 30, 40 years, we will really face a difficult time, I believe, in healthcare to really provide a sufficient care for all these comorbidities. So it's not only for psoriasis, even though it's a neglected diagnosis, I would say, because we don't know enough about dermatology diagnosis at all.
And in Sweden, what kind of measures do you take? You were mentioning prevention, and all of you have found how important even prevention is, not just, as it goes, but starting early with prevention. What kind of things is Sweden doing to aim at prevention of comorbidities, of things getting worse?
Well, I think, we have all these recommendations, how to eat well, already from early age in preschool and schools and up in the ages, and of course sports, exercising. So I do believe it's in the Swedish community to talk about that. But also, of course, we can also see the fact that young people are not, they're not exercising enough. All this social media takes a lot of time and and all the things about, that. But also the fact that we maybe recognize symptoms earlier, that's good, because then we, of course, in prevention, we also take that into account, that when people are being aware of certain kind of diagnosis, because we do have this information system, or we do get information through social media. So that's good in that way. through TV programs and so on, I do believe is good. We have I mean, it's an open window for opportunities here to get information how to prevent and how to be treated nowadays more than ever. But nevertheless, awareness is lacking in some areas, and I do believe when we're talking about knowledge, to really make aware to the policymakers that guidelines is also good to have in each country, to at least have something to really, you know, hold on for everybody.
Thank you. And Ilse, do you find in the Netherlands, what kind, I mean, you may have worked on yourself and discovered so much about the illness, but what kind of general prevention hints were you given when you first went to consult?
Well, it's been discussed more, but still far too less. And we talk about lifestyle a lot, but I don't know any patient with psoriasis that doesn't do anything with their food. But if you ask about it in the consultation room, it's always, oh, there's no evidence. And I think it's a bit changing. It's a bit changing into lifestyle might support your treatment, and it might support you feeling better. And I think that's a good one. But it's also about what are you willing to do? What do you want? And I think if we talk about prevention and if you know that you have a chronic disease and it's not just your skin, but all those tiny little bits help you becoming a bit more better in the future, that might also be a support to do anything about it. Because if we all know we have to walk for a half an hour and eat healthy and all that kind of things. But if it's really you and you get that connection from your healthcare professional, you are willing to do some things. And if you talk about it in the consultation room, I think that's really helping. Maybe not maybe not the smoking, but you want to start exercising, or maybe not. Well, just find that one, two, three things that suits you. And if it starts with about knowing that it helps.
It seems to be a combination of what Pernilla said and what you said.
Yeah.
In other words, that the state can do certain things to give advice, to tell people to eat right and move right and so on, but that the input from the healthcare professional, just speaking one-to-one and saying to you, look, for your particular case and looking at you as an individual, this is what will help you with your lifestyle and will avoid comorbidities. So
yes, and you can't help getting psoriasis. I mean, you just got it.
Yeah.
But maybe with a little bit of doing some things in your lifestyle will help you and help you with a better treatment, or maybe even you don't have a lot of, it helps you getting better.
And I think that helps mentally, because we haven't yet touched on the mental side, and we will eventually, but to know that you are in charge a little bit and can do some positive things, it gives you that strength, you know, that you and the physician are doing this together and you're on a journey, and things are going to get better and stronger if you do the right thing. So that's very valuable. Antonio, in the Netherlands, what kind of prevention did you get, both from the state and from your physician?
Okay, in Spain, we are working in some hospital with 2 or 3 doctor, dermatologists, rheumatologists together with one patient. It's a very interesting position. It's very, very good. Of course, it's not cheap for the administration, but it's very necessary. But I think the Dr. Tiago will be agree with me. But today it's possible, do you have a patient of psoriasis, to detect that any patient could be a very high possibility to get psoriatic arthritis. If you detect that, you could be in the beginning. Okay, you don't have psoriasis arthritis, but now we are going to work to stop the psoriasis arthritis. It's very important, especially in young patients. No, I think today it's possible that and begin, of course, with a biological treatment. Okay, that's important. Really, within in Acción Psoriasis, the Spanish Association, that the multidisciplinary is only the option to stop all the different comorbidity of the psoriasis. We need to have a contact with a multidisciplinary. This is the first question, the political question, I think. Okay.
Absolutely. In fact, you've led me on to my next question for Tiago, which is, what does a truly comprehensive approach to psoriasis management actually look like?
Okay, so I think it clearly includes early diagnosis, early multidisciplinary intervention, potential, or at least trying to have some kind of personalized treatment, and very important, patient education also. This is very important because it's so important that the patient knows about the disease to be able to, if the doctor is not discussing that topic, be able to ask about that topic. And I noticed that in this conversation. So for this multidisciplinary approach, we need a dermatologist. So of course, it's a very central role, but this is systemic disease. You need GPs, you need cardiologists, endocrinologists, psychologists, rheumatologists. This is the only way to address the systemic nature of the disease. But again, we have limitations in the healthcare system. We need a better organization to have this kind of multidisciplinary access. And again, specialized centers already have this, so we have the model. Sometimes we just have to translate. Also, telemedicine may help in some cases. So I think this is what is a comprehensive approach of psoriasis. It exists in some sites, but we need to go to for more places like this.
Well, Antonio was giving the example of psoriatic arthritis and also loss of sight or the evaluation of sight. Can early intervention make sure that this doesn't hit a patient so strongly?
Yeah, we have some evidence. We cannot be sure which patient will have psoriatic arthritis. We know that there are some risk factors. We know that nail psoriasis, obesity, more severe psoriasis may increase the risk of developing psoriatic arthritis. So we know that those patients are high-risk patients of developing psoriatic arthritis. And of course, an early intervention with the right treatment, the right drug, usually target advanced drugs, may decrease the incidence of the disease. So we have some data showing that maybe early intervention in these patients, we may delay the development, at least decrease the incidence of psoriatic arthritis. So again, early intervention, early diagnosis, and early intervention is always better. With a personalized treatment is always better than a late intervention.
That's certainly coming out very strongly in all our speakers about early intervention. Prevention, early intervention, it's really hammering home. So these are some of the action points and important messages that we need to send out. And I mean, really, all of you know exactly what's right. And if you were multiplying this across Europe, we would have a very successful approach to psoriasis. So we just have to keep hammering on and hoping. And really, what practical steps can policymakers now do? This is for you, Pernilla, really. You've been listening to lots of valuable suggestions here to healthcare systems, really, to improve this multidisciplinary care, because as Tiago said, it's not just seeing a healthcare specialist. There's cardiologists and eye specialists and also a mental side of it as well. very complicated for a chronic condition like psoriasis. So what can policymakers do about it?
Well, I mean, it's really a difficult question, because we need healthcare professionals to work together. And that's the first thing, actually. Because I do believe that policymakers do understand the complicated issue of comorbidities. But to organize healthcare so we do have these multidisciplinary teams, that's another thing. And healthcare is quite conservative, I would say. We need strong patient voices and focused patient at the Swedish level. We also work from the European patients' rights. And I think the right to have, personalized treatment is not a contradictory to specialist care. It's really to have this person-centered care for each person, but also to have the ability to come to specialized care, but expect the professionals to work together. And I mean, what policymakers can do is I mentioned guidelines before. I do think that is important, but I also think it's important to see that healthcare need to reorganize. We need to create a better healthcare system in almost all countries to make this happen.
Yes, you've put forward some very good ideas. I like the way you said rights, because it almost should be a human right, that we should be treated holistically, that we should be listened to, and that patients should have an active part in all the points you're making should in a way be human rights. And person-centered is extremely important, both in mental and physical care, and certainly in
Yes, indeed. And I think also the European patients' rights are also saying that each patient have the right to innovative treatments, for example. I mean, that's also something that I would like to mention, that when we reach new levels in treatments in healthcare, we really need to see to the fact that they are also being implemented and not just innovated, and we are very happy about that. But if we don't see them implemented and really being used by patients, it's worth nothing.
Very good point.
From a patient point of view, I think it's very difficult from the patient to change that system, and we really need to work together on that, because I don't want to see 5 medical specialists. I want to see just one. But how can I change as a patient, maybe as a patient representative, maybe from the patient organization I work with? But we need those political and healthcare professionals to work together to change that system, because it's not only for psoriasis, but there are more chronic diseases. They need the same. And I think we're just at the beginning that now we're saying it's a chronic immunological disease. It's not just your skin, but now we need those politicians and healthcare professionals to start act like that. And it's difficult to change for us as patients.
Tiago, do you think that medicine has become too specialized, and that we should also have some generalists who have their hand across, as Ilse is suggesting, so that you can see one person, but they have a broader view, not just their little narrow dermatology view?
I think there's room for everyone. I think specialization is very important. Where medicine now is very advanced. It's difficult to know about everything. Diseases are complex. Psoriasis is complex. So it's very important, the specialization. Of course, it's also important sometimes that player that plays everything, the GP is very important. It's important to have the GP on the team because he's able to connect all the dots. So this is very difficult because we're discussing healthcare systems and we know how difficult it is to change. And this is something that we have to work together, patients, physicians, policymakers, of course. So, but I think that the way medicine is doing now, specialization is very important. We just need to know how we can connect all the dots.
Thank you. So Pernilla, I mean, a total change of policy in medical care. How would a policymaker even begin to think that way?
Well, I think we should have been thinking about that for a long time, actually. But I think the model is to work together. I do believe in collaboration, and that's what I'm doing. What I'm doing at the Swedish level, at least, I try to be a supporter for that also, or be inspiration maybe for others at the European level as well, because I think sometimes we don't use our personal resources enough to be able to speak up and say, we cannot have it this way anymore. We need to make it work better. We do have the strength, but it needs also leadership I mean, from all sides, to be stronger and work together. And when we talk about comorbidities, I wish sometimes also that not only healthcare professionals are working more together. I do think that also patient organizations need to work together. And it's good to hear Ilse is working for an overarching organization. And Focus Patient is not an organization, but an initiative to really connect people over the borders of organizations and topics. So I believe in that way, but we need to see that we do have the strength, but we need the leadership.
Good point. And Ilse, can you give any examples of how your organization of patients is helping to try and change the system for the better?
Well, I think from the patient perspective, we can show what it's like if you see there are a lot of specialists, and if you see the burden of treatment and seeing all those specialists. And we can think, but we don't have to change the system. I think that's the system have to change, and the people and the organization involving. And I think, like Antonio said, there was a good example in Spain where they started to working together. And I know also from the Netherlands and from Belgium where it's starting. And I think it is starting, but we have to learn and we have to be willing to change because it needs a change.
Antonio, have you noticed a change since the work you're doing? What kind of changes have you seen?
Yeah, I agree completely with my colleagues from Netherlands. It's very, very difficult to change the system. For me, for us, there is a very important question. Okay, the question is, who is the star on the system? Of course, the patient, I think. Okay, it's not the doctor or the nurse. If the patient is the star, why the patient are not making decisions in the beginning of the process, not at the end of the process. In the beginning of the process, the patient association must be there, make opinion like all the star, because we are the star of the system. Why we are not now in the beginning of the decision? I have participated in some very important commission in one hospital here in Seville, the Hospital Macarena, and for me it was very interesting to understand how the doctor or the administrator talk about who will be the future of one patient. I asked, okay, I not agree with that. Maybe they need another. Okay. It is important. I resume, it's important to be in the beginning, in the moment of the take decision, not at the end, as now.
Tiago, I mean, how has this evolved? I know that as children, you often go to the doctor and you sort of think that the doctor is God and knows everything. And that kind of feeling persists even into adulthood if you're not careful. So how are you working to make sure that the patient, you listen properly and also that they're treated as an individual holistically, not just as a sign of somebody with psoriasis?
Well, society is changing, so that does not happen anymore. Of course, it can happen here or there, but it's not the rule. Well, I think, again, we need time. One of the problems nowadays is time. I know that physicians, if they have time, they will have the opportunity to discuss with the patient. If everyone is well educated on the disease, the discussion will be better and there will be the shared decision. I think that the systems, the healthcare systems need to be reorganized. We know that this is difficult and this must be a joint, it's shared by the patient and the physician. The physician knows how the healthcare system works and how it could be better. The patient knows how he wanted to use the system. And then there's the policymakers that can help us to do that. So again, I think we need time and we don't have, everyone as a society, everyone has no time. So that's a huge problem. But then there's not enough doctors, so a lot of patients. So this is like this, it's a circle that is very difficult to change. But I think it's discussions like this one at a higher level maybe that can help to change the systems that are different in Portugal, in Latin countries, it's different in Eastern Europe, in Northern Europe. So it's so difficult to have a standard. It would be good to have a standardized healthcare system. We need to discuss and we need to work together.
Okay, but please.
Really, yes, go on. Sorry.
Okay, sorry. No, I think that now the opportunity is the innovation. Innovation is the point is very important, but innovation, the AI everywhere, and now is the moment to begin to work together because the change could be quickly. That's important. Don't forget the innovation. I think for me it's very, very important.
I completely agree. And let me just say this because the patient has a big power nowadays in the society for the politics, for the politicians. So the patients association should lead this way to change because I believe that politicians and policymakers, they are more likely to hear from the patients and of course then talk with the physicians. So this must be led by the patients that have the power on their hands.
Pernilla, this is calling you really because it's all pointing towards policy change. Can you give me any examples of ways that that policy has already started to change, maybe in Sweden?
Well, first I have to say that to be really influencing policymaking, you need to know how it works. And sometimes we lack that knowledge in the patient community. Some are very well trained patient advocates and know how the system works and politics and all that, but some are not. And I do believe that policy training is also, I mean, one way to really come forward with what your most important issues are. So that's one thing that we need to see also from life science industry. I would say that not everybody is working along a good pathway to reach policymakers in the right way, I would say. But I think as we heard our Tiago, he said that we have different healthcare systems and we need to approach them, of course, in different ways. But I think the most general way is also that we need to have a coalition of the willing, so to say, that the people who are interested, let's go out and reach them first. And to see that they are if they're on a good way and they are willing to listen and to see what can be done. Okay, let's start with them and then build from that. To really
make two exceptionally well-informed patients here with us to start with, so that would be a very good start. And Antonia, having looked at what is necessary, what do you think are the barriers? You know, we can all see what's needed, but what to you are the main barriers in Spain to the undertreatment of psoriasis?
Oh, okay. For me, the main barrier is the 17th administration. In Spain, we are a republic in health question. It's very different to live north, south, or west in Spain. Very different, completely depending the postcode. This is in Spain. I think it's a exception in all Europe. This is the first barrier. The second barrier is, I agree with the Dr. Tiago, is the education. Now in Spain, we continue banalizing the psoriasis. It's a cosmetic problem alone. No, it's not necessary, including to visit the doctor. Okay, this is a very important problem. It's a problem for my association for education. But for me, it's the first question. It's our responsibility, not the health system, not the doctor. It's a responsibility of the patient. Okay.
Right. And Tiago, what do you think that what other barriers do you see apart from as well as what Antonio has said?
Let me just give some data on under treatment, because this is a critical clinical issue in psoriasis, mainly in moderate to severe psoriasis. We have great drugs nowadays approved, highly effective systemic drugs, but recent data shows that half of the patients with moderate to severe psoriasis are only being treated with topical therapies, are not even being treated at all, even patients with psoriatic arthritis. So our patients are not receiving the treatments they should be received with the severity of the disease. So this is really a huge problem. One is
what is the barrier to them receiving?
Access. One is access, as Antonio said. Drugs are very expensive, and then it's not equal in the country, within the country, in regions, between countries. This is a very important problem. Then another thing is on physician-related barriers. Many physicians underestimate the disease severity or are afraid of using systemic treatments. So the patients are not being treated, or the consultation time is very limited. So it's easier to give a topical rather than a systemic therapy. So this is a huge problem. And then, of course, it's not a problem of the patients. It's not their fault, but education. It's important that patients are educated on the treatments that exist, so they can tell, okay, but I have moderate severe psoriasis. I want to be treated with a systemic therapy. I know there are treatments to be existing treatments, so I want to be treated. So I think that all these barriers, again, we have discussed this, healthcare, physician, patient barriers. So it's where we have to work on.
But where does the education come from? I mean, you're almost saying that every patient has to more or less find out about psoriasis in order to be able to dialogue with the physician. And how do they get the information?
There are we can do educational meetings. I do an annual educational meeting for a lot of patients. We discuss psoriasis in patient terms, so they can understand comorbidities, treatments. This can be replicated in many countries. Awareness campaign, it's very important. So there are several ways to go to the patients with information. And of course, we don't want them to be dermatologists. They don't need to know everything about the disease, but as a patient, it's important to know a lot of things about the disease that we can easily deliver to the patients. It's not easy, but we can do it.
But as a patient organization, we can send those patients to the patient organization, because we can inform and we have those information sessions. And the best part, I think, you have those other patients you can see. And when patients talk to each other, they learn so much about their disease and how to cope with it and what are the possibilities. And so just send all the patients also to the patient organization.
Tiago.
Just one point, and it's better that patients receive this information from a physician in patient education, from the patient education, from the patient association, rather from the internet. That we know it's a huge problem of I don't want to say fake information, but it's not reliable. So this is very important. Patient education is very important. Physician medical education, very important.
Yes, I know that one can get very frightened if you go onto the internet and follow it all up. You know, you almost feel, if you look at the comorbidities, you almost feel you're hardly there anymore. So that's very good advice. Don't go to the internet. Get the right information from patient organizations like ILSA's, like Panelist, so that you get the information at ground roots, and from your physicians that Tiago regularly also informs the patients. That's extremely good advice. Antonio, there are lots of, hearing a lot about the discrepancies in treatment and so on. There's lots of problems in Spain with access, because it depends really on potluck, you know, which region are you living in as to what kind of treatment you're going to get. So what would you say to improve the access for patients to get the appropriate treatment throughout Spain, and indeed throughout all countries?
Yeah, Spain is one of the most bigger countries in Europe. It's quite different. We are 47 million people, and it's very, very difficult to have all that. But there is two questions important. One unique portfolio for the Ministry of Health. Now we don't use. It's unique portfolio. Okay, is depending where you live, in the unique portfolio, it does important. And the second is the negotiation with the pharmacological industry, the industry, okay, because now there is 70 moment to send, okay, and it's very different to buy biological treatment in North and South Spain. It's necessary to improve a unique portfolio, a unique negotiation with the industry. For me, it's important.
May I add something about, you know, knowledge and so on, because I'm so surprised that some countries do not have national registries also for all these different diagnoses. I mean, how can they really predict the costs for treatments or for patients in you know, hospitalization days and the kind of treatment they need and so on and so on. So, I mean, the lack of quality registries that you can really see from the beginning through lifetime also, and what causes one disease and what kind of treatment do they have and so on. You can see a lot of things through these registries if you have them, but without them, it's hardly not possible at all to really predict anything. So I really encourage anyone who looks at this webinar to really look out for, you know, improvement of these registries. It's I think it's necessary for everyone.
That's a very useful and concrete suggestion for action. I mean, all countries could, that is one thing any country anywhere could do, is to improve its database, its registries. We in England, in the UK, are pretty poor, I have to say. We're trying to establish registries, but we are not getting very far, and our computer systems weren't very good. So that is an extremely good practical action point. Thank you, Pernilla, for that. And you're nodding as well, Ilse. Is there a good system in the Netherlands for registering people who have psoriasis?
Not for all the treatments. There are options for biologicals, but not for all the treatments. And but there's some research being done. But it's a good challenge to get everybody in a registry would really help to predict and know also the outcomes. So you can really help with shared decision making. So that's a very good solution.
But you know, in England, I can say, Pernilla, that there's a reluctance because people are worried about where their data might go or even be sold. Have you found this reluctance in Sweden?
I don't think we have a very high digital maturity in Sweden. I think over 90%, you know, are you know, they use digital tools every day in some way. So I think the reluctance is not that big because quality registries has been used in Sweden for decades, and we do use them, I think, for prediction, not the least. I mean, for treatments and improving treatments for patients. And I mean, everybody can use them also. That's one point. But I mean, they are decoded, so it's not about personal information. So I don't think we should be afraid of that kind. I mean, when using registries, it's another thing with other kinds of health data. I mean, for patients to provide by their own consent. That's totally another thing from your own patient journal and so on.
Yeah, because I know that in UK, that people sell off some of the data, and there has been a problem with that. But obviously in Sweden, you're a bit more rigorous, thank goodness.
We have so many regulations about this.
I'm glad you do. I think that's very important. And Tiago, how important for you is it to have a registry with the patients? Does that improve your ease of work?
Yeah, the registry are very important. It's a way to evaluate real world data, to have real world data, real world evidence, to understand patient outcomes, effectiveness, safety of the diseases. Portugal is one of the countries that we are just now developing our psoriasis registry just now. But we as Europe, we have so many things that we have not in common, that is shared. How about establishing European psoriasis registry? This would be nice to have all data of all countries in Europe. So this would be a good option to try to have also, because one of the problems is also the registries may be very different between countries with very different information. So it's also important to standardize the registries and the data we have from the registries. Yeah.
That is a very practical suggestion, but I can imagine that it will be quite a long process, because already to establish a register in your own country takes time. To try and standardize that on 27 countries and different regions is going to be, a mammoth thing. But then with AI, maybe that will speed it up. Maybe it'll make it much easier.
We can see it in cancer. We have a cancer inequalities registry at the European level, so it's possible. But it also depends on the national facts and figures that are really delivered to this registry. So if you have very old figures, of course, it's not comparable with every country that has higher, better rates for treatments or something like that. So it really depends also on the national level how it's done, actually.
That's true. And it will constantly need updating. You won't be able to just have a register and finish. It'll be input as it goes along as well. So it sounds a brilliant idea, but let's just hope it works. And we've come up with some terrific ideas from all of you just in the last 45 minutes. I'm really impressed. But let's pull some of the threads together now so that we end up really with some concrete calls to action and recommendations. So Ilse, tell me really in the next minute or so what you think of as the most important action points.
Well, the most important for me is stop underestimating that psoriasis, it's not just a skin disease, it's a systematic disease. I think that's the most important part. And changes always start with one person, most of the changes. So just be that person that wants to change.
And what action would you like to see happen?
Well, I like the multidisciplinary teams around one person. I like the registry, but only if it comes to the patient. So be transparent. Let that outcome also be for the patients, so that I know what the treatments options are for me, and what the outcomes are for me. Maybe also from each center. That's a good one.
Yes, and much more personal, holistic care, and also, of course, on the mental side, which we've hardly touched on, but which you mentioned, Ilse, when we were chatting. So tell me about the importance of the mental caring side.
Well, it is, because if you have a chronic disease, you have to cope with it. And if you treat well and early, I don't have to cope with it that much. So that really helps. Having a clear skin really helps you with coping, and also, but it's a journey that takes time, and it's a journey also must be part in the consultation room.
Exactly. It should definitely be part of the consultation, both the mental and the physical side and the comorbidities. And Pernilla, in terms of policy and policy change, what are the most important action points for you?
Well, I do think registries, as I mentioned, I do think they are important for every actor in healthcare and life science. So that's really number one for me. As a former policymaker, I would really like everyone to look at that, because I do think it can increase the quality of treatments as well. And the next one is to create awareness through policy. I mean, to be aware also how policy works. It's a tool for change. So, and I know from my earlier work as an MP that it's different between countries how you reach out to your politicians, of course. But I think when we create these connections and networks and go together, we can make change happens. So collaboration is the word.
Collaboration indeed. Thank you, Antonio. I'm sure you echo that. Give me a brief idea of change that you think should be put into action.
Oh, okay, I say you. To make decision from the beginning in all the action, the patient association. This is make decision together. And when the appointment with the doctor, make decision too about the treatment. What is better for me, I want all the information, I will be a very good patient, okay, in accordance. And the third question, I think is important, is the multidisciplinary ordinary. Maybe I don't need a dermatologist tomorrow, I need another specialist. That's important, the question multidisciplinary. But of course, for me, the title is the make decision together.
Right. Well, I'm sure that Tiago has taken all your suggestions on board. Tiago, what would you add to that for action?
Completely, but also actions to overcome the under-treatment issue. We have the drugs, but the patients that have an indication to be treated with those drugs, they need to receive those drugs. So actions to try to overcome the difficulties of the physicians, the time of the consultation, medical education, empower patients, education again. And of course, try here and there reorganizing the system so that these actions can really work.
Thank you. Well, you've all crystallized so much in the last hour or so. It's been absolutely amazing hearing your ideas. If people were listening now, I think the whole psoriasis system would be revolutionized. I hope it does, and I hope this makes a great difference and that it equalizes care across localities, regions, nations, that people are taking this on board, that registries will be created, that people will listen properly to what the patient has to say, and that the patient and health caregiver will collaborate properly, both mentally and physically, and that we have an awareness of comorbidities. And doctors and patients and nurses, of course, as well, as Ilse will emphasize, need to be working hand in hand. Early diagnosis, as we've said, improves the situation immensely, and comorbidities awareness as well, so that psoriasis patients can get the best possible care from the very beginning, nice and early, all the way through, because there are many positive things that can be done in the treatment. Of course, it's still work in progress. We haven't got the registries properly yet set up, but we have gone quite a long way today to seeing some very concrete suggestions, and we hope that the current situation from listening to this and from taking notes that this could really improve life for so many people across Europe and across the world who have psoriasis. So now, after everybody who's watching and listening to us, our webinar, thank you very much for being there. Do open the Economist Impact report, because it's hosted online on the Economist Impact webpage. It's free, so you can just go to it. If you Google, the item is called Beyond Skin Deep, Tackling Gaps in Psoriasis Care. I'll say that again, Beyond Skin Deep, Tackling Gaps in Psoriasis Care. And you'll see it'll deal thoroughly with many of the issues that we've discussed so clearly today with such a very good panel. So I'm afraid we have to wind up now, but not before I've managed to thank the wonderful load of contributors, our introductory speaker, Yasmin Greenmeyer, who set the scene brilliantly. I wish we'd had more from Yasmin. And our panelists, Ilse van A, Pernilla Gunther, Antonia Manfredi, and Dr. Tiago Torres. And thanks all to the technicians, including Robin, and to you for watching us online. Thanks to Bristol Myers Squibb for sponsoring our roundtable, and a special thanks, although he won't want one, to Daniel Tanatoff and his team, including Bram and Enrique, who put a huge amount of hard work into the support and preparation of this session. So I hope you've got a lot out of it. I hope you'll go with a lot of tangible thoughts on how to improve the system. And from all the panel and from me, Rini Wyndham, have a nice afternoon. Goodbye.